Enjoy.
My guest today is Jozo Grgic, a researcher from Croatia with a master's degree in exercise science. Jozo is currently doing his PhD in exercise science and exercise physiology, with a focus on the effects of caffeine supplementation on exercise performance at Victoria University, Melbourne. Jozo has co-authored around 30 peer-reviewed papers, collaborated with the likes of Brad Schoenfeld and many of them, with a focus on resistance exercise prescription and caffeine supplementation. Jozo, really appreciate you taking the time today.
Yeah, thanks for having me.
Terrific. Well, maybe we can start this conversation off with you giving listeners a little bit more about your background and how you got into the research side of things.
Yeah, sure. So in 2014, I finished my master's degree back in Croatia. Towards the end of it, I developed interest in science, in the science part of it. Did one project for my master's thesis. In the 2 years afterwards, kind of worked as a personal trainer, but I found myself often reading science papers, and back in 2016, decided to go back to school. Decided to publish more. Hooked up with Brad Schoenfeld, and we collaborated ever since. And last year, I started my PhD here at Victoria University, got an offer for a scholarship in Melbourne. So I moved now and doing my PhD in exercise science, and we predominantly focus on the effects of caffeine on exercise, mostly on resistance exercise. Yeah, and that's pretty much it.
Phenomenal. Well, looking forward to talking caffeine and resistance training here today. And of course,
yeah, likewise.
Of course, many beverages and foods do contain caffeine, but obviously, coffee is sort of far and away the most popular, I believe, second only to water as the most widely consumed beverage. And apparently I was reading about 1.6 billion cups of coffee consumed every single day, which is sort of mind-boggling. So if we jump in here and talk the effects of caffeine on resistance training, can you discuss how caffeine might impact things like maximal strength and muscle endurance?
Yeah, sure. So we just recently published a review paper on the effects of caffeine in resistance exercise. And I've also published a few original papers prior to this one. And basically from the current evidence, it seems that caffeine increases both strength and muscular endurance in resistance exercise, as well as muscular power. So caffeine, some of the mechanisms by which caffeine can increase performance in resistance exercise seem to predominantly relate to the effects of caffeine on motor unit recruitment. So there's actually one really cool paper that examined this topic. It was published a couple of years ago. And they tested the effects. They tested motor unit recruitment before the ingestion of caffeine, and after the ingestion of caffeine, and it showed that basically the recruitment of motor units is increased by around 10%.
Interesting.
And that increase in motor unit recruitment is probably the primary reason, the primary mechanism that might explain the effects of caffeine on strength. Now, when we talk about the percent change or the effect of magnitude of the effect, it's not quite large. It's actually pretty small. So in our study where we tested the effects of caffeine on upper and lower body strength, the increase in strength was around 3%. With quite a high dose. It was a dose of 6 milligrams per kilogram. So while caffeine can definitely increase performance in resistance exercise, the effect magnitude might not be all that high.
Yeah, I suppose it depends on the population. 3% can be a lot, obviously, in the more elite and trained individuals. Is it similar in terms of the changes in power with the caffeine? In terms of the effect?
In general, it seems that the effect of caffeine is somewhat greater on power. So the effect of caffeine might be more on increasing contraction velocity than maximal force production. With that being said, there's only a couple of studies that examined power. in resistance exercise. So I think there's only four. The majority of studies examine the effects of caffeine on strength, and so the effect might be a bit greater on power and on endurance than on strength in resistance exercise.
And amongst those, when we look at differences between lower body and upper body exercises, are there tangible differences there, whether it's maximal strength, power with caffeine?
Yeah, so like historically, it has been suggested that the effects of caffeine seem to predominantly manifest in the lower body. So that study that I talked about motor unit recruitment, so they examined percentage of motor unit recruitment in the quads and in the elbow flexors. And before the ingestion of caffeine, the percent of motor unit recruitment in the quads is around 85%. But in the elbow flexors, it's around 97, 98%. So when you ingest caffeine, there's a much more greater area for improvement in the lower body, because the percentage of motor unit recruitment in the lower body is not towards its maximal values, while in the upper body it seems that it is. So there was one meta-analysis published in 2010, and they observed that the effects of caffeine predominantly manifest in the lower body, but not in the upper body musculature. That study that we did a couple of years back, we also tested the effects of caffeine on upper body and lower body strength. We used the back squat exercise and bench press, and there was a significant increase in lower body strength. And then a couple of months back, we actually did a meta-analysis on the effects of caffeine, focusing only on 1RM tests. And in that meta-analysis, we actually found the opposite when we pooled all of the studies. So meta-analysis means that we reviewed the evidence and pooled the studies that examined the effects of caffeine on a specific topic. So we looked at 1RM strength. And the effects seem to be greater in the upper body, which is in contrast to the meta-analysis from 2010. So it's kind of still tricky to say.
Yeah, I imagine. And for yourself, in terms of, what would your opinion be in terms of what might be happening there between those two conflicting results? And does it depend on, the individuals in the population, whether we're talking sort of untrained individuals versus, team sport athletes versus even, let's say power lifters?
I would get my thoughts are that there's not a lot of studies that compare directly both upper and lower body strength tests. And when you pull meta-analysis that examined, when you pull studies in a meta-analysis that examined different strength tests, sometimes you can get some unpredictable results. So my thoughts on it are that probably caffeine can increase both upper and lower body strength, but the magnitude of the effect is probably lower for lower body strength. As far as the training status goes, I'm not too convinced that the effects differ between trained and untrained individuals. It is commonly suggested that the effects of caffeine are predominantly in trained lifters, but there's only one study that included both trained and untrained, and they actually found the opposite. So caffeine increased strength in the untrained individuals, but not in the trained individuals.
Interesting. So lots to be parsed out then.
So it's a lot of conflicting findings. So.
And what about the rate of perceived exertion? Obviously, in endurance athletes, we see this as a significant benefit. Does that also translate as well with resistance training and caffeine?
Yeah, so there is pretty good evidence suggesting that the performance-enhancing effects of caffeine in aerobic exercise are predominantly due to the effects of caffeine on reducing RPE, or rating of perceived exertion. But in resistance exercise, I don't honestly think so. In our study that we did, we actually observed a decrease in RPE, which was coupled with an increase in strength, suggesting that RPE might also contribute to the performance-enhancing effects in resistance exercise. But I think predominantly the effects of caffeine are on motor unit recruitment in resistance exercise. Reductions in RPE might contribute to the performance-enhancing effects, but I would say the jury is still out on that one. It's still pretty unclear.
Yeah, that's really interesting stuff. And I previously had Nancy Guest on in season 1 of the podcast talking about her research in caffeine and endurance athletes, and of course that the ability to metabolize caffeine, and obviously the main enzyme responsible for caffeine metabolism, cytochrome P450, that CYP1A2 gene, which accounts for 95% or so of the caffeine clearance, and she found that there was what she called ultra slow metabolizers that actually had a negative impact of caffeine on their endurance performance. Do you think that's a phenomenon that might exist as well with resistance trained athletes?
Yeah, there's actually one study just recently published. They showed a similar effect. But with that being said, both of these studies used a similar caffeine supplementation protocol. So they administered caffeine 60 minutes prior to exercise. So if we have slow metabolizers of caffeine, maybe they still can increase their performance by supplementing with caffeine, but they just might need to ingest caffeine like 90 minutes before exercise or 2 hours before exercise. And that's an area that still needs to be investigated, obviously. But I'm kind of when we say that there's non-responders to caffeine, I'm kind of skeptical of that because I think everybody can ultimately respond. Only the matter is the optimal protocol for the individual.
Absolutely, yeah. It is amazing how that individualization and that rate of metabolizing caffeine is probably a key part of this whole story. And as you mentioned, the timing of it becomes then important, whether it's 60 minutes, 90 minutes. And before we dive into that, could you talk a little bit as well about the ability of caffeine to impact pain perception? Because obviously training intensely elicits a lot of pain. Was there any evidence there in your review on resistance exercise?
Yeah. So caffeine, when ingested, caffeine binds to the adenosine receptors. So after binding, caffeine can basically blunt pain, and therefore it's also very common in pain relief medications. So in resistance exercise, it doesn't seem like that a decrease in pain perception contributes to the performance-enhancing effects. There are several studies that examine this, and you see performance increases in resistance exercise in terms of increased strength or increased endurance, and there's no effect on pain perception. In our study, we actually saw a decrease in pain perception, but there was no effect on the improvements in the upper body strength. So the evidence kind of, I don't think that it contributes to it, but we definitely need more studies on it. And the problem is the ways that we currently measure pain perception. We use subjective scales, which may not be completely, may not be the best option. I'm not sure what the best option would be, but they're kind of maybe not as accurate as some other models. So
for sure. And in your research, you also found that caffeine ingestion led to some increases in hormones like testosterone, cortisol following resistance training. Can you unpack that a little bit for folks? What's going on here, and is it really having any tangible impacts on outcome?
Yeah, well, caffeine studies that conducted thus far do show that caffeine increases testosterone and cortisol release following resistance exercise. But there have actually been a couple of studies by Stuart Phillips and his lab. They actually show that the changes in muscular strength and increases in muscle size are not correlated to the acute changes in hormone levels. So even if caffeine can alter hormone production or increase cortisol or decrease testosterone or even increase testosterone, it's probably not very relevant for people who are interested in supplementing with caffeine in the long term. With that being said, there are no long-term studies, so we can't say for sure, but I'm kind of suspect that it actually even matters.
Yeah, likewise. I think, as you mentioned, well said there in the, obviously, Stu Phillips' recent paper there, the hormone hypothesis, and sort of putting that to bed. And, you used, the dose ranges in your review there, 3 to 9 milligrams per kg, definitely getting up pretty high towards the 7, 8, 9 milligrams per kg. What's the potential effects there for folks if they are going towards that upper end, and is there sort of a sweet spot for caffeine dose that might elicit some of these benefits for resistance training?
Yeah, so currently it seems that the doses anywhere in the range from 3 to 9 milligrams are effective. But we are talking mostly about the capsule form of caffeine. There's also a really nice review published a couple of months back where they summarized the studies that examined alternate forms of caffeine, like caffeinated gum, and those forms are very often ingested in lower doses, like like an absolute dose of 100 milligrams. And some of these studies actually show not in resistance exercise, but they show that caffeine, even in those alternate forms in lower doses, can be quite powerful. In resistance exercise, there's actually only one such study. It's actually an unpublished study. It's a thesis, and they examined caffeinated gel, and the dose was 75 milligrams, I think, which is quite low. And they saw a really nice increase in strength performance. We currently kind of lack true dose response studies to see what the optimal doses are. Most of the studies use like 6 milligrams, and there's not a lot of studies that use 3 or 4 or 5 different doses to see what the optimal effects are. There's one study that examined the effects of 2 and 5 milligrams of caffeine on strength, and only 5 milligrams was effective, but 2 was not. And in another study, they examined 3, 6, and 9 milligrams. And they examined contraction velocity, meaning they lifted lower and higher loads as fast as possible. And the doses of 3 and 6 milligrams were effective for training with 25 and 50% of 1RM, I believe. But when the load got up to 90% of 1RM, only the highest dose was effective, so 9 milligrams.
That's so really interesting. Yeah, it's amazing the different effects. And of course, as you start pushing past that 6 milligrams per kg, you definitely start getting into that zone of potentially things like anxiety or insomnia, or impacting things that in the long term could obviously become problematic. But it's, as you mentioned there, I mean, if you're training at certain periods of phases of training or sessions where you are going to 90% or more, it seems like there could be some good basis there for having some sessions with much higher doses. Is that what are your thoughts there?
Yeah, like if you're a power lifter before an important competition, you might try ingesting such a higher dose, but doing it over time, I would not recommend. The side effects can be pretty strong. When you actually do studies and when you see the responses from individuals after they ingest even 6 milligrams of caffeine, the side effects can be really bad. And there's actually one study showing that when you ingest caffeine in the evening hours, your sleep quality is hindered. So, like there needs to be a balance. Do you want to risk poor sleep for a 3% increase in strength? I don't know.
Yeah, you got to be really smart about your context and what the goals are, and really put that into the individual that's in front of you, or the athlete, definitely. Exactly. And Jozo, if we talk about females and caffeine use, I know in Nancy's study was obviously all males, and the endurance study makes it a little easier to extrapolate the findings there. But how do things change for females when it comes to caffeine? Is there much research on this topic?
There's actually been only one study, I think, that examined the effects of caffeine in resistance exercise that included both men and women, and that study showed a similar response. Maybe around 80% of the studies in the current evidence include only men, because men are kind of easier to investigate, because in women, based on the phase of the menstrual cycle, the metabolism of caffeine can change. So in that context, they represent maybe a more complex population to conduct studies on. In fact, some of the meta-analyses that have been conducted thus far include only studies that are done exclusively in men, around 80% and above. Some meta-analyses include only studies with men, because there are no studies conducted in women doing certain exercise tasks. So based on that one study that I mentioned briefly, it seems that both men and women can experience similar ergogenic effects of caffeine in resistance exercise. But again, that's only one study. So we obviously need a lot more to make any firm conclusions on that.
For sure, yeah. I mean, it's interesting for female athletes and females in general. Obviously, you mentioned the menstrual cycle impacting things. Obviously, the birth control pill would do that as well. So,
Yeah.
For sort of anecdotal N=1 type stuff, I mean, women and female athletes can start to see how they feel depending on the cycle of that caffeine intake. Could be interesting because there could be some different, as you mentioned, effects or in terms of how they respond to caffeine depending on the phase of the cycle, correct?
Yeah, correct. And there are a couple of studies that included only women, and they generally show ergogenic effects in women as well. But when you extrapolate like recommendations like that, our recommendation that the effects, that the optimal doses are somewhere in the range from 3 to 9 milligrams, it's mostly based on studies that were done in men. So I'm not sure that the same would apply in women. But as I said, we obviously need many more studies to make any firm conclusions about potential sex differences in the responses to caffeine.
And how about in terms of the form of caffeine? I mean, we talked about this before. You mentioned some chewing gums and gels. What about coffee versus supplemental forms of caffeine? Do we know much about if one form is superior, or is it all about in terms of the rate in which it's taken up by the body?
Mm-hmm. So I think in 1995 there was one study that examined the effects of caffeine on endurance performance, and they had multiple trials, and including coffee, decaf coffee, and coffee with caffeine, and so on. I think it was 5 conditions, and they actually showed that only caffeine in the capsule form was effective for acute increases in performance, but decaf coffee with added caffeine was not. And that's kind of a seminal study in the area that showed that, if you want to supplement with caffeine, coffee might not be equally effective. But one limitation of that study is that they used a time to exhaustion test for assessing performance, aerobic endurance performance. And these tests are kind of notorious for having low reliability, meaning they vary a lot day to day. So there might have been some confounding factors in that study, in that older study, but in the studies that have done something similar in resistance exercise, they usually show that both coffee and caffeine, if the caffeine dose is matched, are equally ergogenic, meaning that it can basically be personal preference, the source of caffeine that you ingest.
That's good.
Now again, yeah. With that being said, it's kind of hard to match the caffeine dose in coffee, and there's actually a really nice paper by Ben Desbro, just recently published. They show how the effects can how the caffeine content can vary day to day in coffee. So it's kind of in the lab it's easier to match the doses, but for the general population it's kind of it can be tricky to match the caffeine dose if you ingest coffee only. I'm not sure if I'm making any sense here, but
yeah, no, for sure. It was interesting in that study. They showed obviously the Monday and Tuesday. I'm not sure if it was Starbucks or some other coffee chain where the doses were around 400, 500, and as the week went by, the amount of caffeine in that same size of coffee was going down to 250 or so.
Yeah, exactly.
So you sort of don't know what you're getting when you're going to get a dose from a coffee shop. Now, if someone's more of a recreational exerciser, that might not be an issue unless you're starting to experience a lot of adverse impacts of caffeine. Then you may want to start to figure that out. But obviously for athletes, it becomes important, doesn't it, to know the dose and not be subject to kind of this varying dose of caffeine, particularly if you're trying to shoot for 9 milligrams per kg. You wouldn't want to overshoot that by too much.
Yeah, yeah, definitely. If you want to be precise, caffeine capsules are probably the easiest. It's the way to go.
And in terms of habituation, I know this is one where previously it was thought that, athletes and individuals can build up a tolerance and therefore not obtain the same sort of ergogenic benefits from taking caffeine. I've seen research since that disputes that and shows that you're still going to get the benefit regardless if you're habituated or not. Where do things stand on that front, Joseph?
Yeah, so as I mentioned, some of the mechanisms of caffeine relate to its binding to adenosine receptors. So caffeine, when ingested, it binds to these receptors and can alter like RP and various other factors, and therefore enhance performance. So in animal models, they have shown that when you give animals caffeine often, there's an increase in concentration of the adenosine receptors. And based on these animal model studies, they have hypothesized that in people who ingest caffeine on a regular basis, you would not experience the same performance enhancing effects of caffeine as somebody who does not ingest large quantities of caffeine daily. So this topic is kind of, in humans, it's not very well investigated. Some of the initial studies actually showed that the magnitude of the effect is greater in the non-caffeine users. There's actually one paper by Bell from 2002. The problems with these studies is that they often classify users and non-users on a broad spectrum, kind of like people who ingest less than 50 milligrams of caffeine per day are classified as low users, and those that ingest, I don't know, above 400 milligrams per day are high users, and they kind of disregard the middle group, which is very relevant given that the average caffeine intake in the population is around 160 milligrams per day. And these studies are kind of that show that the magnitude of the effects differ between low and high users are limited, given that they don't use any validated questionnaires for assessing habitual intake, which is probably the most important thing to use from a study design perspective. And there's actually been a recent study, I think it was published a year ago by a group from Brazil, and they classified the participants as low, moderate, and high users and used a validated questionnaire. So they addressed some of the limitations from the previous study designs, and they actually showed, they used a cycling time trial test, and they showed that the improvements were equal in all three groups, so even the low and moderate and high habitual caffeine users.
Interesting.
In resistance exercise, yeah, there's no such studies. We actually have a ongoing study where we are examining 3 different doses and the effects between low and high users, but the data collection is still in process. So I'm not sure what the results going to be in resistance exercise, but I don't see any reason why the effects would differ between a cycling time trial test and resistance exercise.
Gotcha. And Jozo, in terms of the washout period, is it around 4 days? Is that accurate? If someone did want to go through that dehabituation process, what's the washout period for caffeine?
Yeah, the caffeine half-life is usually around 4 to 6 hours. Not actually 100% sure when the caffeine is totally cleared out of the system, but I'm guessing you're right, kind of 3 to 4 days probably.
And it's interesting you mentioned there kind of the average intake being 160 milligrams. I know when it's reported in the news and on blogs and whatnot, they'll often tell folks, 3 cups of coffee in a day. And of course, in the study, that's around 300 milligrams. And, obviously the cups of coffee are getting bigger and bigger, especially over here in North America. So I think sometimes there's a bit of translation issue, because I know, a venti size at Starbucks might have 450, 500 milligrams. So if folks are having 3 of those a day, it's a big, you mentioned dosing before. It's a far different effect, isn't it, than having just the 3 8-ounce cups of coffee?
Yeah, exactly. Those studies that report the average intake are done probably in 2013 or 14. So I'm not sure if anything has changed. Maybe the average intake in the population is kind of increased in the last couple of years. I'm guessing that it has increased, probably.
And you mentioned the chewing gums obviously taken up in the buccal mucosa more rapidly, and is that something that team sport athletes might be thinking about using as a halftime intervention to support performance, or potentially if someone is competing in an event to be able to time that, because I know a lot of these events, especially powerlifting, can take, go on throughout the course of the entire day. So what are your thoughts there?
Yeah, so in general, in studies that use capsules, they use timing of 60 minutes pre-exercise, which would be kind of too slow for a soccer player who wants to ingest caffeine in the halftime. So there's actually been one timing study, and they examined the effects of caffeine in the form of chewing gum. I think it was 5 minutes prior to exercise, 30 and 60 minutes prior to exercise. I'm not too sure. And the effects were significant only when the chewing gum was given 5 minutes prior to exercise. So that kind of shows that how fast caffeine can absorb when administered in chewing gums. So it can definitely be a strategy for athletes and for the general population as well. If you need a fast acting,
quick hit for sure.
Yeah.
And Jozo, what about if we kind of shift gears to a general population again and talk, blood pressure? If someone does have a history of high blood pressure, does caffeine, acutely affect blood pressure? Does it affect it in the long term?
Yeah, so there have been a couple of studies that examined the effects of caffeine on blood pressure in resistance exercise, and the evidence it's all over the place. Some studies do show an increase, but the increase is kind of small. It's not a large increase in blood pressure. But if you're working with somebody, or if you're an individual who has high blood pressure, you might kind of use lower doses of caffeine, because caffeine increases blood pressure in a dose response manner, meaning that the larger doses, the larger the increase in blood pressure. So if you have high blood pressure, maybe try to ingest try experimenting with lower doses of caffeine. It may also increase heart rate. So it needs to be put into context. If you have some issues with high blood pressure or increased heart rate, maybe caffeine is not for you.
Yeah, I mean, definitely, as you mentioned, getting down towards that lower dose. I think people consume greater doses than they're aware of. I know Dr. Ian Dunican was on before talking about rugby players and their pre-match use of caffeine, and a lot of them, as a lot of athletes do, adding 2 or 3 scoops of the powdered caffeine versus just one, and not realizing they already have caffeine in their pre-workout. But obviously, studies showing for people who do regularly consume coffee, there are no associations or important effects of long-term coffee consumption on blood pressure or risk of hypertension. But of course, you definitely want to talk to your doctor about that. So appreciate the insights there, Jozo, and definitely appreciate you carving out the time here. So I want to respect your time here today and ask you a few final questions here. In terms of the evolution of research around, caffeine use as it relates to, resistance training, even endurance training or athletic performance, where do you think things are going in the next sort of 5 or 10 years?
Well, we are actually just finishing up a paper where we kind of highlighting some of the areas that need further study, and I think some of the interesting areas are pertain to the time of day when you ingest caffeine. For instance, our muscular abilities, such as strength, tend to be lower in the morning hours, and then they peak in the evening hours. And there's been one study that examined the effects of caffeine both in the morning hours and in the evening hours, and then they showed an increase in morning, but not in the evening hours.
Interesting.
So, because our abilities are naturally reduced in the morning, there's probably a greater potential for caffeine to be effective in the morning hours. If your strength levels are peak at 6 in the evening, and you ingest caffeine, then there's probably not a lot of area for improvement with caffeine ingestion. And there's only been a couple of studies, and they generally showed a similar effect. So I think that's probably one of the areas that's going to be investigated in future studies. Other areas include timing of caffeine ingestion, as we spoke about for different genotypes. I think that's going to probably receive more attention in the future. Other areas probably relate to the optimal dose of caffeine. As I've said, there's not a lot of dose response studies, and that's kind of the basic question for somebody who wants to consume caffeine. It's how much caffeine should I ingest? And we still don't have a clear answer on that topic. Those are probably some of the areas that I think will receive much more attention in the future studies.
Yeah, fascinating stuff. The circadian rhythms and sort of chrononutrition of what time of day you're taking that in and how it impacts is really fascinating to me. So looking forward to seeing that come out. And Jozo, for yourself, if you're giving advice here to listeners, to athletes, to practitioners, what's a simple piece of advice or one piece of key advice that you would give around this topic of caffeine for resistance exercise?
Be careful with the dose. That would be probably my...
Nice.
Yeah. In our study that we did, we used 6 milligrams of caffeine, which is kind of considered as a moderate caffeine dose. And some of the participants reported really strong side effects, like they could not sleep for the entire night after the ingestion of caffeine. Or you can see kind of like the personality of people changes when they ingest caffeine. They become so amped up. I don't know. I think like the dose of caffeine is probably the most important thing, and you always want to start with with a smaller dose of caffeine. You don't want to jump into 6 milligrams when you're starting supplementing with caffeine. Maybe try 1 milligram per kilogram and go on from there. But the caffeine dose probably is the most important thing.
Great advice. Yeah, definitely a minimal effective dose seems to apply really well to this topic. And Jozo, I think the question everyone's waiting to hear here for yourself, I assume you're a coffee drinker. If you are, what's your coffee habits in terms of the type of coffee, amounts?
Espresso coffee, and usually three per day. And I think I'm kind of, I need to maybe increase it because the effects seem to be getting smaller and smaller. And I know that I'm an addict to coffee, given that on one occasion I actually drank a decaf coffee without me knowing it was a decaf coffee, and I had such bad side effects a couple of hours later. So I definitely need my coffee, 3 cups per day. It's usually the norm for me now, but I might even increase it.
Yeah, I imagine as you're getting through to finishing your PhD, the consumption goes up with the closer you get to finishing that up, probably, right?
Yeah, that would actually be an interesting study.
Awesome, Jozo. Listen, I really appreciate you taking the time. Where can people stay connected with you on social media and keep up with your phenomenal research?
Well, I'm on ResearchGate. You can just type in my name, it will pop up. And I'm also on Twitter, so you can follow me there.